Tokyo officials say COVID cases there have surged 155% over the past 7 days. A beach volleyball player is now the latest American athlete to test positive, as officials say they're still considering canceling the games altogether, with the opening ceremony just 2 days away. ABC's Kenneth Moten is in the Olympic bubble in Tokyo with more on this. Hi, Kenneth. What's the latest on this positive case, and what does it mean for Team USA?
Well, Diane, we know this American beach volleyball player is in quarantine here in Tokyo after he tested positive at the airport. USA Volleyball has not released his name, but here's what we do know, that he's in quarantine again at a local hotel. And also, when it comes to his sport, we understand that even though volleyball qualifies and plays in pairs, you can replace an athlete up until Thursday evening. So there's still a chance for him to be replaced ahead of that Sunday match.
How hard is that for that person's partner, then, if they have to play with someone new?
Very difficult. Can you imagine knowing that you have trained with this person, you qualify with them, you've gone through the ups and downs of trying to make it to the Olympics through the Olympic trials, and then there's this last-minute replacement. But when it comes to Team USA, a lot of these athletes, Diane, they know each other, and so hopefully it won't be that big of a difference for his partner, for his playing partner, but still, yeah, it could be pretty tough.
Now, the chief of Tokyo 2020 organizing committee said that officials will continue discussions as they monitor cases. Has there been any more talks about potential cancellations?
Well, no public talk. We don't know exactly what's going on behind closed doors, but you would think, Diane, they've got to be talking about this when it comes to those surge in numbers here. And when he dropped that line on us, that bomb on us yesterday about an 11th hour, possibility of an 11th hour cancellation, it was like a ripple effect through the globe as people, know that 11,000 athletes will make their way to this country over the next 2 weeks. Tens of thousands of people connected to these games are already poured into this country. But when you're talking about those numbers of those who are coming into this country connected to this game, and the fact that we've had about 70 or 80 positive cases since July 1st, that number may seem small, but here's why it matters, Diane. Health experts are raising alarm, warning that this virus is spreading faster than during the third wave of infections at the beginning of the year. Just today, Tokyo reported a 6-month high of new cases, more than 1,800. And so you add all that together, and it's just not a good recipe.
And meanwhile, women's basketball player Sue Bird and baseball player Eddie Alvarez will be carrying the American flag at the opening ceremony. So what can you tell us about why they were selected?
Well, they were selected because they're pretty bad. You know what? They were selected by their team members on Team USA. About 600 athletes voted for them to be the flag bearers. And let me tell you about them. They've got an impressive CV here, each of them. Sue Bird, a 4-time Olympic champion, and baseball player Eddie Alvarez, a 2014 Olympic silver medalist in speed skating. Again, they were chosen by their fellow athletes. That's how high of esteem they are. They're seen there. Bird made her debut in Athens 2004. She won 4 straight gold medals and is trying to get her 5th. Alvarez has competed in the games before, currently plays pro for the Miami Marlin minor league. He's the first baseball player to be a flag bearer in the opening ceremony for the U.S.
Now, organizers say that this is the most gender-equal Olympics in history. What do they mean by that?
What they mean is it's a turning point, and it's incredible to see, especially when you compare the numbers of men to women over the past, really the history of these games. And let me give you those numbers. I typically don't like to list a bunch of numbers, Diane, but these are so impressive. Let me give them to you. This is up from 45% at the last games in 2016. Organizers have said that women accounting for nearly 49% of the 11,000 athletes. And again, that's up from 45% of the last games in 2016 in Rio. It was just 2.2% at the 1900 games in Paris, the first to have female athletes. And when the games return to Paris in 2024, there is anticipated to be full gender parity with the same number of female athletes to men. How about that, Diane?
All right. Times are a-changing. Kenneth Moten in Tokyo. Thank you, friend.
Thank you.
And let's bring in infectious disease specialist and ABC News contributor, Dr. Simone Wilds, for more on this. Dr. Wilds, great to see you. Thanks for being here. When you look at the number of cases in the Olympic Village so far, how worried are you? And what do you think the chances are of them needing to cancel these games at the last minute?
Diane, thanks for having me. I'm definitely concerned about the numbers that keep increasing each day. I know the athletes have prepared for such a long time, so I know it must be really disheartening for them as well. But I think that there's going to be a lot of discussions going on behind closed doors about what's the best step forward. The key thing is that we want to make sure that everyone is safe, and I'm sure there's a lot of protocols in place to ensure that that's happening. But I think at the end of the day, they're going to really see, what is going to be the greatest impact, whether to keep going forward or to cancel the games. And I really hope that we can go forward with the games.
Now, a new study is also suggesting the Johnson & Johnson vaccine could be less effective against the Delta variant. Yesterday, the CDC director faced some tough questions about why the U.S. is taking so long to authorize booster shots. So do you think this is going to accelerate that conversation, and how should we be looking at this new study data?
Absolutely. I think there's going to be definitely more conversations about what to do with this new information about the Johnson & Johnson vaccine with regards to how it acts with the Delta variant. I think there are a number of things that are going to happen. I think more than likely they're going to probably talk about booster shots for those who have had the Johnson & Johnson, either with the Johnson & Johnson vaccine itself, or they might consider using the messenger RNA vaccine, either the Pfizer or the Moderna, just to ensure that people who got the Johnson & Johnson have added protection, especially with the variant rampant.
And how concerned should we be about breakthrough cases? How contagious are those people who are vaccinated and then still get COVID afterward? And can they still get long hauler symptoms?
Great question. I mean, right now, everyone is talking about breakthrough cases, but I really want to stress that the key is it's still very rare. I know it's popular right now, but, we've had more than 159 million people vaccinated and thousands of people get breakthrough. So a very small number. I think we'll just continue to watch things closely. We do know that those that get the breakthrough infections tend to have milder disease. So usually those are not the ones hospitalized. We will monitor them and see, how numbers go. But I think that in general, you should still be safe getting the vaccine.
Now, some students start going back to school as early as today. Considering the spread of the Delta variant, what should parents and school officials be doing to maintain safety?
Really hot topic right now as children get back to school. Key thing is we really want to get children back in school in person. There are a number of things that I'm really a strong proponent of, making sure everyone wears their mask. I'm really hard to distinguish those who have been vaccinated versus those that have been unvaccinated. So I think it's just safer to have everyone wear masks. Cleaning protocols are going to be important. Ventilation is absolutely going to be important. Testing and quarantining, those are big things that we really need to make sure that are in place as the children get back to school, because we want to make sure they have in-person learning coming up for the next school session.
And what about in states where they ban school districts from implementing mask mandates? We know that the CDC and the AAP are mixed in terms of what their recommendations are for masking in schools. But how do schools that don't have that option mitigate the spread?
One of the things that they're going to have to do, there has to be more discussions between the both groups, especially in states where the vaccination rates are low. I think people really need to put all the politics aside and come together and really talk about what is safest for our children.
All right, Dr. Simone Wilds, always great to talk to you. Doctor, thank you.
All right, thanks for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.